So, to treat his elevator phobia, the first psychotherapy session consisted of taking the elevator. Is it exposure, flooding, desensitization, or torture? What technique is that? So is it... Okay, so the right answer was actually flooding. Because in exposure, it's always gradual. Exposure is gradual. Flooding is actually you expose straight away to the most phobogenic situation, okay? So, let's see who answered right. Tunisia Tuna on top, very quick answer. But, champions and champs are not that far behind. So let's move on to the next question. Among the following, what makes an antipsychotic atypical? Is it partial D2 agonism? Is it 5-HT2A antagonism? Is it 5-HT1A agonism? Or any of the above? Again, what makes an antipsychotic atypical? Is it partial D2 agonism? Is it 5-HT2A antagonism? Is it 5-HT1A agonism? Or any of the above? And the right answer is actually any of the above. So any antipsychotic with at least one of these properties is classified as atypical. Some of them have two or even up to the three properties at the same time. Like aripiprazole, for instance, has three properties. Okay? So, who's on top? Tunisia Tuna again. They see that people who answered the first question right got it wrong this time. So, let's move on. Third question. 15-year-old female patient admitted following a suicidal attempt. She's most likely to have major depressive disorder, ADHD, bipolar disorder, or none of the above. So you have a 15-year-old female patient admitted following a suicidal attempt. By likelihood, let's say, by probability. Is she more likely to have something like major depressive disorder, ADHD, bipolar disorder, or none of the above? Two teams haven't answered yet. Yeah, you got it all right, none of the above. Okay? Why? Can you tell me why? Okay, because in most cases, suicidal attempts in teenagers are not associated with a psychiatric disorder, okay? So, second on top, followed by champions and Tunisia. Okay, let's move on. Fourth question. Esketamine effects on depression are explained by BDNF increase, dopamine reuptake inhibition, 5-HT6 and 5-HT7 antagonism, or 5-HT1A partial agonism. I know you were waiting for NMDA antagonism, but that's an easy one. So you all know esketamine is an anti-NMDA drug, an NMDA antagonist, but how do we explain the efficacy? Is it BDNF, dopamine reuptake inhibition, 5-HT6 and HT7 antagonism, or 5-HT1A partial agonism? By the way, these are all like antidepressant effects, clinically. So, one answer. Okay, so the right answer, BDNF increase through antagonizing NMDA receptors. This is the hypothetical mechanism of action for esketamine. So, let's move. The best team, has the strength of... No, because you're not among the 5 first teams. So this is only for the first.
I thought it was just a technical difficulty.
No, not at all. You only show the best. So, next. John, 25, was diagnosed with treatment-resistant schizophrenia. When started on clozapine, his mortality increases mainly because of the risk of neutropenia. increases because of metabolic side effects, increases mainly because of the risk of myocarditis, or decreases? What do you think? So, when we put him on clozapine, so this guy will see his mortality increase because of neutropenia, increase because of metabolic side effects, increase because of myocarditis, or decrease. What do you think? One answer left. And so the right answer is actually mortality decreases. So the best team is still on top. Okay. So let's move on. Peter is an introvert guy. He's most likely to have schizoid personality disorder, schizotypal personality disorder, obsessive compulsive personality disorder, or no personality disorder. What do you think? So the right answer is no personality disorder. Most introvert people are actually perfectly normal and they have no personality disorder at all. They're not schizoid or schizotypal, not at all. Okay? So, yeah, this thing is still on top. So, let's move to the next question. What attachment style does the video depict? So you will see a video here. You'll see a video here.
Once he's ever settled down to play, a stranger enters the room and sits in a chair reading a magazine. After a couple of minutes, the stranger attempts to interact with Lisa. Soon after, Lisbeth gets a cue to leave the room.
We should do it. We should do it. Oh my god.
To answer too quickly.
Yes. Oh my god.
The stranger tries to keep Lisbeth comes back into the room, and the camera records how Lisa reacts.
So,
Now the first part of the procedure is over, and Lisbeth settles Lisa down again. The stranger leaves them alone together.
okay, I think it's clear by now. I'll just skip the rest of the video. Okay? So, one answer left. Yeah, you got it all right. Totally secure attachment style. Okay? So, let's move to the next question. Scores. Best team on top. I mean, by a good margin this time. So they're 1,700 points. Okay, ahead. Let's move to the next question now. Brexanolone has been newly approved for postpartum depression, and its main mechanism of action is GABAergic, serotoninergic, glutamatergic, or dopaminergic. Brexanolone for postpartum depression, mechanism of action: GABA, serotonin, glutamate, or dopamine. What would you choose? The main mechanism of action, okay? So, one answer left, one answer. Yeah, so the main mechanism is actually GABAergic. Okay? So, let's see who's on top. The best team still. I think you're ready on. You're going to choose the case scenario first. Okay. But don't forget the first four teams will qualify to the semifinals, okay? So, ninth question, patient with bipolar disorder on valproate, pregnant 14 weeks. Shall we keep the same treatment since the harm is already done? Shall we switch from valproate to lithium? Shall we decrease the dose of valproate to the minimum effective dose? Or shall we add carbamazepine to accelerate the metabolism of valproate? Which one would you choose? Do we keep the same treatment, the one is already done? Switch to lithium? Decrease the dose of valproic acid to the minimum effective dose? Or add carbamazepine? And the right answer was actually switch from valproic to lithium. Don't forget that the teratogenic effect and especially the effects on neurodevelopment are not dose dependent. And even with very low doses of valproic, you still have an impact on the neurodevelopment of the child, okay? So lithium after 14 weeks is actually quite fine. You just have to monitor the levels and so on. But yeah. So, one question left. So, last question, guys. Among the following, which is not the target domain for interpersonal psychotherapy, which is not a target domain, role deficit, grief, self-esteem deficit, interpersonal role disputes. Exactly, so self-esteem deficit is not the target domain for interpersonal psychotherapy. So, the podium, the third, 7. Where's the team 7? Me too, and then the best of the best, the best team. So the best team, ME2, 7, and champs move to the semi-finals, and the best team is going to choose which case scenario, actually, okay? Okay, but before that, so let's move now to, we have different case scenarios here, okay? And you have to choose one of them. So we have, 6 case scenarios. In fact, I don't know, we have some. You can choose actually even 2 case scenarios, and you can split 2 teams. Okay? I mean, you can choose so who was the 4th team actually? The 4th. So you will play against the best team this time. And they will have to choose, because their rank was better, they will choose which case scenario. And then the second team was ME2, is that true? Me too. Okay, me too. And they will play against, and who will choose the case scenario will do it. But the first team is going to choose first, so which case scenario among these would you choose? One, please. Racing Heart? Is it your last decision? Racing Heart? Okay? So, Racing Heart. Last decision, or do you want to change? Come on. Chameleon, okay. So, let's move to the chameleon. Okay, let's see. Right now, okay, sorry. Okay, so you have 11 questions for chameleon, okay? Is that good? Sorry. I think there's a problem here. Okay. So, please join the game now. So you will put another pin, okay? So this is the pin. So the best team is playing against the champs. Okay. So please enter the game using this game pin. You can choose allies, other teams to help you if you want with the answers. Do you want allies? You can have allies as well. Lies are quite useful. Believe me. So, you have to join the best team, yeah? Okay, great. So, okay. So let's start here. So, we have a 21-year-old female patient with no medical or psychiatric history, no significant family history, brought by her parents for behavioral changes over the past few days, okay? Preceded by an episode of flu or flu-like symptoms, okay? So, let's move to the question. Ready? So, this video shows, you'll see a video here, and you'll choose the right answer. I don't know why the sound is so... The sound is really bad. Okay, so it's actually mixed symptoms here. So I think you know the case now. Okay, so mixed symptoms, exactly. Let's move to the next question. So we both got it in the maximum score. We got the maximum score. Sorry, I'm really sorry for that. This is wrong. Sorry, we are going to repeat. I made a mistake. Just, yeah. Now you know the right answer, but you have to, sorry. There was a mistake. So please rejoin the game, both of you. Sorry for that. And yeah, now you know the right answer. You'll get the same score after all, no problem. Maybe I want to try the winners. But you know, a bit alike can make you lose. Okay, so let's start. Again, sorry for that. So you all put mixed symptoms and we'll move on, huh? Okay? Okay, so just put mixed symptoms. Okay, so you both answered correctly, for sure. Obviously. Okay, so now the parents inform you that a few days ago, the patient had an episode of tonic-clonic movements of her limbs that lasted 2 to 3 minutes, with no loss of hearing. On that day, the patient was coming back from a party. Physical examination was unremarkable, okay? So, the question now is... Okay, so here, of course, we're returning to our Kahoot. Okay, so which of the following investigations would be helpful in this patient? EEG, MRI of the head, lumbar puncture, or all of the above? What would you choose? So the answer is all of the above, actually. Okay, she needs an EEG, she needs an MRI, she needs a lumbar puncture as well. Okay? So, let's move on. Here. So, the EEG was unremarkable. MRI was unremarkable again. And the diagnosis of a possible psychogenic versus drug-induced seizure plus bipolar disorder with current manic episode with mixed features was made. Okay, don't forget she was coming from a party and she had a seizure just after a party. So, like, drug-induced seizure was deemed likely. And the patient was started on olanzapine. Okay. A few days later, the patient had another seizure, followed by a change in her symptoms over the following days. And the parents are certain that she did not take any alcohol or drugs over the last week. Okay? So, we have 2 questions on a row here now. So, let's move Who answered faster? Yeah, so the best team had the correct answer. Okay, so the symptoms in this video are consistent with. We have another video. Again. The sound is very low for some reason.
No, right there. Right here. You just called me a spoiled brat. Just say it. You just said it again. Just say it again. Why are you doing this to me? Why? Why are you trying to sleep like to me? I haven't done anything to you. Why are you trying to sleep like to me? I heard you say it.
Okay, basically the symptoms are mainly psychotic symptoms, mainly auditory hallucinations, persecutory delusions. And of course, these symptoms can be consistent within this video with post-ictal psychosis, of course. Don't forget, she had a seizure and a second seizure. Okay, they can be due to psychotic features associated with mania. So you can have psychotic features with mania. They might be due to, after all, drugs. You know, drugs can explain every single symptom that the patient has had so far. So the right answer was actually all of the above, okay? So let's move on. The best team on top again. And at this stage, what would you do? Would you continue on olanzapine? The seizure was probably psychogenic. After all, this patient had a normal EEG, don't forget that. Switch to aripiprazole, which is less epileptogenic than olanzapine. Repeat investigations or add valproic acid, both as mood stabilizer and for epilepsy. And the right answer, of course, is that we have to repeat investigations here. We still don't have any diagnosis. It looks like organic psychosis or something of that kind. And we don't have any clear diagnosis. So we have to repeat the investigations. And actually this is what was done to this lady, okay? This is exactly what was done to her. And the EEG was again unremarkable. The MRI was again unremarkable. And the lumbar puncture showed the following, okay? So just have a look at the findings here for the lumbar puncture, okay? Then, so the patient was actually continued on olanzapine, since there are no abnormal findings here. So she was continued on olanzapine, and the dose was increased from 10 to 20 milligrams. She was not responding, so we just increased the dose. Okay, the working diagnosis was still bipolar disorder. Okay? So, question. Let's move here to the next question. And so, a few days later, this is what happened. Again, another video, don't even need the sound for this. So, neuroleptic malignant syndrome is to be ruled out. Another manifestation of mania until proven otherwise. Conversion disorder, seizure-like with normal EEG and catatonia-like symptoms, or watch out for secondary gains. What would you choose? So, NMS to be ruled out. Yeah, and that was the right answer actually, because we know that NMS can present as catatonia. The patient is on antipsychotic drugs. She probably has some sort of organic psychosis, which further increases the likelihood of NMS. So NMS has to be ruled out first. Okay? So let's move on to, let's continue with our case. So the patient was actually admitted. NMS was ruled out, lorazepam started, okay? And after a few hours, the catatonic features subsided. She was no longer catatonic, okay? So we have 3 questions here. Let's move back to our cabote. The best team is on top. And So, as part of the cognitive assessment, the patient was asked to perform the clock drawing test. And this is the result here. What does the result suggest? Does it suggest executive dysfunction, spatial hemi-neglect, hemianopsia, or working memory impairment? And the right answer was obviously spatial hemi-neglect. Why not hemianopsia? Who answered right? Why not hemianopsia? Okay, because the circle is full. No, yeah. But in fact, because people with hemianopsia generally can move their head to compensate for the loss in their visual field, whereas people with hemispatial neglect won't compensate. Okay? So let's move to the next question, but first, the best team is far ahead. So, which diagnosis among the following would you consider? Schizoaffective disorder, brain tumor, limbic encephalitis, or multiple sclerosis? So, with the findings so far, you have the clinical findings, the MRI, the EEG, the CSF, everything put together, and the right answer is actually limbic encephalitis. Multiple sclerosis with 2 normal MRIs is very unlikely, okay? Limbic encephalitis is actually compatible with a normal MRI, with normal CSF, with normal EEG. So this was the second, and now, last question, yeah. So, not last time. Which investigations would confirm the diagnosis? So, serum and CSF, cerebrospinal fluid, anti-neuronal antibodies, EEG video. Okay, so you all got it right. This was an easy one. Serum and CSF anti-neuronal antibodies. Great. Let's get back to our patient here. So, we repeated actually again an MRI which was again unremarkable, but now we repeated the lumbar puncture and we found positive anti-GLU-N1, or in fact, so NR1 is a subunit of the NMDA receptor, so it was an anti-NMDA encephalitis, okay? So, back to our Kahoot. The best teams, quite ahead. So, which of the following confirms the diagnosis of anti-NMDA receptor encephalitis? Positive anti-GLU-N1 IgG, IgM, IgA, or any of the above? This is a difficult one. So IgG, IgM, IgA, or any of the above? What do you think? So the right answer was IgG. In fact, IgM and IgA anti-GLU-N1 can be found in patients with schizophrenia, and they are not diagnostic of limbic encephalitis. So, next, so the best team again on top. So, which of the following is likely to be the most useful drug to improve the patient's psychiatric symptoms? Aripiprazole, which is effective on both psychosis and manic mixed symptoms. Okay, so you all got it right. Corticosteroids, obviously, we have a cause here that we can treat. So we won't treat, the main thing is to treat the cause, for sure. So last question, the best team, yeah, you already won, I guess. So,
demoralizing.
and what other investigation should be performed? Repeat MRI of the brain, FDG PET scan of the brain, Tau PET scan of the brain, or MRI of the abdomen and pelvis. Which one would you choose? The right answer was actually MRI of the abdomen and pelvis. Why?
To search for cancer.
Exactly. Teratoma. We have to look for teratoma. Okay, paraneoplastic condition possibly, and you have to look for neoplasm, mainly teratoma. Okay, so MRI of the abdomen and the pelvis. Exactly. So next, so now we finished. And the best thing on top, you got 7 answers out of 11 correct. This is very good. Okay. Let's get back here. So no teratoma was found. The patient improved on corticosteroids with virtually no sequelae. There's a problem with the sound here, even though it's connected, I don't know what. But in fact, this patient says that how many people were actually diagnosed with schizophrenia, with bipolar disorder, with all kinds of psychiatric disorders, whereas they actually had an inflammatory disease on the brain that could have been stopped and treated easily. And thank you for your attention. So, let's move to the second, so semifinals, exactly. So yeah, the other teams actually can play, I think, because otherwise it would get a bit... In fact, you can play, yeah. If everyone can play, I think it's better for everyone to play, but yeah. But in fact, yeah, only we will just count the team, yeah, the teams who were supposed to play. Okay, who are the 2 teams supposed to play? 7 and me too. Okay. Okay, you can join the game, but so me too. You gotta choose which case scenario. So choose one, not chameleon, of course. Which one? There's no Leonardo DiCaprio in the quiz. Okay, to shame? Sure? Are you sure? Okay. So let's move to, yeah, I'm just... Okay, so... The last answer, please. Who hasn't answered yet? So you have 11 seconds left. So the right answer was actually control impulse disorder. Why not OCD? Because the fact that it is not triggered by distress or by anxiety or anything of that kind. It's driven by pleasure. So it's totally different. So in that kind of disorders is more likely to be controlled impulse disorder. It's more of an impulse than of a compulsion. Okay? So let's move to the next question. So the physical examination was actually, so you see BMI 38, hirsutism, otherwise unremarkable. Labs, well, CBC, BNP, renal liver function tests, unremarkable. So BNP is basic metabolic profile, cell blood count, so they're unremarkable. Okay? So question, let's see first who answered correctly. So me too. We are on top. Okay, so second question. Which of these endocrine conditions would best explain the presentation? Hyperandrogenism, hypothyroidism, hyperprolactinemia, or hyperestrogenism? Which one would best explain this presentation? Hyperandrogenism, hypothyroidism, hyperprolactinemia, or hyperestrogenism? Which one? So obviously hyperandrogenism. Why? Hirsutism increased easy, increased sexual drive. You know that sexual desire, even in women, is more related to androgens than to estrogens, okay? So, let's go back to our patient. So, the labs here, so we obviously request for labs, so that showed actually that, yeah, the testosterone, delta 4, androstenedione, and DHEAS levels were normal, within the normal range, okay? So, CBS, where are the CBS team? Yeah. Team composed of only one player, okay? And me too are so. Let's move to the next question. So the working diagnosis was actually impulse control disorder, not otherwise specified. You would start the patient according to this diagnosis on aripiprazole, fluoxetine, risperidone, or valproate. Which one? So we still have 4 answers to go. So aripiprazole, fluoxetine, risperidone, or valproate. The right answer was fluoxetine actually. Why fluoxetine? It's an SSRI for impulse control. So you know that impulse control is linked to serotonin deficit. And it's more logical to give an SSRI than to give anything else, okay? So, and that's actually what happened to our patient. So our patient was actually discharged on fluoxetine 20 milligrams daily, okay? 1 week later, she was brought to the ED by her parents because of an even increased frequency of her masturbations. And there were no new findings in the clinical examination. Same thing, simply exacerbated, okay? So, 1 week after she was started on fluoxetine 20 milligrams, let's not forget that. So, CBS on top, me too, close behind. So, this exacerbation could be best explained by paradoxical SSRI effect, by fluoxetine lowering the epileptic threshold, by a manic switch on fluoxetine, or by the patient having some sort of paraphilia. So, what do you think? How do you explain the exacerbation? So there were two possible answers. The paradoxical SSRI effect. So if you think of an impulse control disorder, you may have a transient exacerbation when you actually start SSRIs. For all anxiety disorders, for OCD as well, you can have, for impulsive control disorder, you can actually have a transient exacerbation of the symptoms during the first days of treatment with SSRIs. So fluoxetine lowers the epileptic threshold, so you think that it might be an epileptic. It's also possible, we never know. It's definitely not a manic switch on fluoxetine. She has already had these symptoms, and she only has this inhibition. And there's no other criterion for that. The patient having some sort of paraphilia, of course, not at all, okay? So you start considering the possibility of epilepsy after all, and you repeat the analysis going more in depth into the patient's symptoms. And what you find out is that the symptoms actually start by tinnitus for a few seconds. Then you have masturbation followed by orgasm that lasts about 2 minutes. And then there's fatigue, okay? The patient says that she feels very tired after that, okay? And this lasts for about 15 minutes. Okay? Question here, again. Meteor are on top. CBS got it wrong this time. So, an EEG was requested, and which abnormalities do you notice on this EEG? I'll make it a little bit bigger, if I can. I don't know, yeah. I don't know if it's clear here. So what do you see? Spike language patterns, theta rhythm, delta rhythm, or none of the above? So here you see that there's the patient opened his eyes here. So actually, this is a totally normal EEG. This is a totally normal EEG. So here you have the alpha rhythms. So this is a totally normal EEG, mainly posterior. And when the patient opens her eyes, the alpha level is suppressed. This is totally normal EEG. Okay? I know it's difficult. Yeah, but I mean, the fun comes from challenges. So, the EEG was actually unremarkable. There was an MRI of the brain performed, and it was unremarkable as well. So the diagnosis of epilepsy was considered rather unlikely. So normal EEG, normal MRI, the patients and her parents were reassured. They were told, look, this worsening of symptoms is actually transient, and this is explained by the paradoxical effects of the SSRI. Don't worry. What happened? Well, 2 days later, the patient, you guessed it, is brought again to the ED. And immediately after one masturbation, she had an episode of loss of consciousness with hypertonia of the forelimbs that lasted a few minutes. Okay? This is these are actually true case scenarios, actual cases, huh? And this is how they were actually treated. So, we have 3 questions. So, we'll see now. Me too on top? Okay, so the most likely explanation to this new symptom is first, fluoxetine-induced generalized seizure, or secondary generalization of a focal seizure, or fluoxetine-induced convulsive syncope, or conversion disorder that's maintained by secondary benefits. What do you choose? Is it fluoxetine-induced generalized seizure? Is it the secondary generalization of a focal seizure? Is it fluoxetine-induced convulsive syncope or conversion disorder? What do you think? So we are waiting for the last one to answer, and the correct answer was actually a secondary generalization of a focal seizure. I think it was pretty easy.